State data shows there are 245 patients with COVID-19 in our local hospitals. That's the highest number since March 11th at the tail end of the record-breaking Omicron wave. The CDC and Metro Health have each moved San Antonio into a higher risk category. Local doctors blame the spike on new subvariants. KENS 5 reporter Matt Houston explains why they say you should consider masking up again.
In the last month, COVID-19 hospitalizations have more than doubled in our area, up now by 143%. Doctors blame two newer versions of Omicron emerging in Texas, though not yet at the rate they're showing up in other states.
So that would indicate that we're just at the very beginning of this current surge.
Dr. Ruth Berggren says the new subvariants appear even more infectious than the first Omicron strain, but even less lethal. That's good news for nurses and doctors, though they say it's time to mask up in public indoor places again.
Most hospitals aren't feeling the concern of a COVID wave yet, and hopefully we won't. I think we're all very busy.
Hospitals are still trying to catch up on the care so many of you delayed during the pandemic, and too many people are showing up to the ER with mild COVID symptoms, forcing those with real emergencies to wait.
And we get very stressed about that.
The doctors noted these numbers represent people who are actually hospitalized for COVID treatment. Most clinics have stopped testing everyone who comes in, meaning asymptomatic people with broken bones, for example, won't show up as patients hospitalized with COVID. These latest numbers are higher on their own.
And Matt Houston joining us live now. Matt, what about test numbers? Are those higher as well?
Yeah, Isis, they are generally, but those numbers aren't necessarily so accurate because so many people are taking tests at home, and it's difficult to report that data. So that discrepancy makes some numbers look worse than they really are, and other numbers look better than they really are. Hospital data now is really the only or best way, at least, to determine how fast the coronavirus is spreading in our community. Live in the Medical Center, I'm Matt Houston, KENS 5.
Matt, thank you.